welcome everybody, and Happy New Year. Thank you for joining us. We have a presentation on exercise or motivation to exercise in 2023. So with us today, I have Katie from the Dixon YMCA and Dr. Plescia that works out of our Oregon clinic. So to kick it off here, I'm going to kind of start talk about motivation. All right. Like I said, our talk today is on motivation to exercise in 2023. So a lot of these presentations, I like to talk about motivation, since most people know, what they need to do to exercise and so forth. They need 3 to 4 times a week, 20 to 30 minutes of exercise. But usually the hardest part is motivating yourself to get out there to exercise. So the first one, what's your motivation to start? So it could be anything from, hey, I just want to get fit, do something better for myself, or maybe it's, you went to the doctor and he told you need to start an exercise program or so forth. So kind of be specific in what you're doing to kind of get you started. So if you haven't done anything for a little bit, to get you going to exercise, kind of set you some goals to get started. So what we want to do is make it a habit for yourself so that you want to exercise instead of have to. So in that, I have to go exercise, that, hey, I want to go, I enjoy to exercise, and you kind of get to that point where you're consistently exercising where you miss it if you don't go that day. So the biggest thing is, how do we eliminate those barriers or excuses of not to get out there to exercise? So just a couple of tips to kind of help to kind of get over that hump with that. So the first one there, I have schedule your exercise. So if you're one that has schedules at work, on your phone or whatnot, schedule it in as part of your day. The other thing that I usually tell people is, if you're a morning person, schedule it that first thing in the morning. Maybe you have to get up a little earlier or so forth. But if you schedule it first thing of the day, nothing else can kind of stop you from doing it. So if something else happens later in the day, some sort of emergency, you can't do it. So as long as you get it done, get it out of the way first thing in the morning. Next is find ways to kind of fit it into your regular schedule. So if you are busy, maybe find ways like during your work day, maybe when you park at work, to come in, park a little bit further away, so you have a little bit more time to walk in. If you get a 30-minute lunch, maybe take 10 minutes of that to get out to exercise, to walk or whatnot. So find ways that you can kind of incorporate in there. If you have kids' events and have to take them to a sporting event in the evening, maybe you can walk while they're at their sporting event or so forth. The next one is an exercise partner. So you have someone there to kind of help you be accountable for exercise, that maybe meets you to exercise to kind of get you there. Next one is to track your exercise and kind of make goals with it. So if we write something down, we're more apt to kind of stick to it. We can kind of see our progress as we go along. And then the next one is explore different options. There's a lot of different options out there to exercise to get you out there doing some stuff. And I'll pass it on to Katie, and she can kind of talk about some of those different options and so forth with that. One thing that I'll link in the description too, you can kind of see there's a contest. Every year KSB does a weight loss contest called the Jackpot Challenge. So maybe that's something that's going to help you motivated to get started with that. And then the last thing that I have down there at the bottom, remember you can't out exercise a poor diet. So just because you're exercising doesn't mean that you eat bad too. So those kind of go hand in hand with that. So I'll pass it on to Katie, and I'll let her kind of talk about some different options for exercise.
Thank you, Aaron. So my name is Katie Matteson. I am the fitness manager at the Dixon Family YMCA. And just like Aaron was saying that, there's so many different reasons to be motivated when it comes to working out. And one of my other jobs is I'm a group fitness instructor at the Y. And I feel like for those people who need a little extra boost, getting into those group fitness classes are going to be great, to joining other members who are doing the same thing, you know, trying to better their health. They're going to kind of cheer you on and you're going to cheer them on. So it's a great way to stay motivated in those group fitness classes. And at RY and at other gyms, there's a variety of different classes you can choose from, whether it's low impact or up to high intensity as well. Now, just even if you go into a class and you're not sure what's going to happen or you have questions, always make sure you talk to an instructor. They're going to be there to help you modify any exercise that you may need. So by doing those classes, those are going to be really great for motivation and accountability as well. Now, if exercising in group settings and stuff like that isn't your thing, you can also use the wellness centers or weight rooms. And I recommend when you're using those, there's like 3 components I always like to use is doing a warm up in the beginning, and then in the middle, doing a strength training plan, and then at the end, the cool down. So usually for the warm up and the cool down, you're doing some type of aerobic exercise. Now in the beginning for the warm up, you're kind of getting your body ready for what it's about to do. So spending about 10, 15 minutes trying to warm up the body, whether it's on the treadmill or elliptical or bike or rowing machine. And then after that, moving into some of the weights, whether it's pin loaded machines, dumbbells, or body weight exercises. Always remember when you're doing exercises to listen to your body. Make sure you're not pushing yourself too hard, especially if you're new to working out. And then finish that with a cool down of about 5 to 10 minutes, letting your body get back to that resting rate. And then also incorporate some stretching, because that's going to help make your muscles more flexible and also make them stronger as well. So also other ways to incorporate exercises, you can also hire a personal trainer. They're going to be there to help you, kind of show you how to use equipment, how to work out, teach you proper form and technique as well. And then also with personal training as well, whether you want to be in the weight room or the wellness center, most trainers too will offer pool exercises as well. So you can do this either with a trainer or without a trainer. Pools are great to use, especially if you're just coming out of physical therapy or if you're easing into working out again, especially with those patients or members who have arthritis. It's going to be a lot easier on your joints getting into that pool. They have a bunch of different equipment in the pool, whether it's the water dumbbells or noodles. So those are also great ideas too, to kind of get moving and whatnot. And then going back to personal training again, usually with a personal trainer, they're going to help kind of customize your workouts for you, making sure that you're going to do everything safely as well. So the most important thing when filling out those forms is making sure you put every information that you need on there. So it's going to include some medical information as well. So if you feel you're not certain that you should be working out or you have some questions, always refer to your doctor. Make sure you meet with your doctor before starting any exercise program. And then with that being said, I'm going to take it over to John.
Well, thanks, Katie. My name's John Plescia. I'm a family physician up in Oregon, Illinois. And that's great information. The YMCA in Dixon is excellent. Up in the Oregon area, we have Nash Recreation Center, Curves, and Rain XT, all of which are great gyms to help people get started. There's often concerns about, the question, am I healthy enough to exercise? And almost always the answer is yes. Only if somebody has had heart attacks or strokes would they require more extensive workup. But exercise is a great idea for just about everybody. The saying goes, heart health is brain health. So we need to move more. We need to get the blood pumping and our heart rate up. The holidays, we pack on the pounds. There are so many temptations out there. A neighbor yesterday just dropped off a whole bunch of cookies, and it's tough to find that moderation. So New Year's rolls around and so many people get that resolution that this is going to be the year I'm going to exercise. And so often we see a lot of people show up the first few weeks in January and then it tapers off. The goal is to keep at it. But kind of the idea behind seeing your physician before exercising or starting a program is to optimize your health. As Aaron mentioned, there are often barriers. For example, if somebody has shoulder pain or knee pain or hip pain, that may deter you from getting an exercise program. What the doctor or nurse practitioner can do is address that. Maybe it's just going to need some stretching at home. Maybe it's going to require a formal physical therapy appointment and evaluation before starting your exercise routine. Maybe it's just going to be Tylenol and ibuprofen. In that case, we would investigate your kidney function and blood pressure to make sure that it's safe to take those NSAID medications, which includes ibuprofen, Motrin, Aleve. So that's something to think about. There are no specific guidelines that say you need a certain evaluation before starting exercise, but there are some red flag signs or symptoms to watch for. And those include chest pain or pressure, especially on the left side, but it could be on the right also. Any pain radiating to the back or the left shoulder or left jaw, that requires attention immediately. Whether you're planning to exercise or not, you would want to contact your healthcare provider. Other things would be extremely rapid heart rate, or what we call palpitations, where you just feel your heart racing. If you have these symptoms and they are occurring often, that definitely needs to be addressed. As Katie mentioned, I would start slowly and really listen to your body. If you've been very sedentary, walking for 5 minutes may be all you can do in the beginning, but you will slowly work your way up. The idea is to listen to your body. You will be sore in the beginning, and that's okay. That's not a bad thing. You're just slowly going to have to increase the intensity or the duration of your workouts. This is one of the best things you can do and invest in your own health. And not only are you going to be preventing long-term problems with your health, you're going to feel better almost immediately. As the pounds start to come off and you start to breathe easier, you're going to be really happy that you're doing it. So Happy New Year and take care.
All right. Thank you both for presenting. And, like Dr. Plescia said, Happy New Year to everybody. Thank you.